Question 1. Which client should the nurse assess first during shift change on a medical surgical unit? A. Client with a blood pressure of 150/88 mmHg who is scheduled for discharge. B. Client with a potassium level of 6.5 milliequivalent/L and reports muscle weakness. C. Client receiving antibiotics for a urinary tract infection. D. Client with a healing abdominal surgical incision. Answer. B. Client with a potassium level of 6.5 milliequivalent/L and reports muscle weakness. Question 2. Which task is appropriate for the nurse to delegate to an experienced, unlicensed assistive personnel UAP? A. Assess a client with suspected deep vein thrombosis. B. Teach a client how to self-administer insulin. C. Perform post-mortem care for a deceased client. D. Evaluate a client's response to a new pain medication. Answer. C. Perform post-mortem care for a deceased client. Question 3. A nurse receives report on 4 clients. Which client should the nurse see first? A. Client with pneumonia who is due for a scheduled dose of antibiotics. B. Client with a chest tube who reports sudden shortness of breath. C. Client receiving enteral feedings through a gastrostomy tube. D. Client awaiting physical therapy for ambulation. Answer. B. Client with a chest tube who reports sudden shortness of breath. Question 4. Which of the following actions can a nurse delegate to a licensed practical nurse, LPN? A. Developing a plan of care for a newly admitted client. B. Performing an initial assessment on a post-operative client. C. Administering oral medications to stable clients. D. Evaluating client teaching outcomes. Answer. C. Administering oral medications to stable clients. Question 5. Which action demonstrates the nurse is maintaining patient safety when using restraints? A. Tying the restraints to the side rail. B. Releasing the restraints every 4 hours. C. Applying restraints loosely to prevent skin breakdown. D. Obtaining a provider's order prior to applying restraints. Answer. D. Obtaining a provider's order prior to applying restraints. Question 6. The nurse is caring for a client who develops hives after receiving an 4 antibiotic. What is the nurse's priority action? A. Administer diphenhydramine. B. Discontinue the 4 antibiotic immediately. C. Notify the healthcare provider. D. Monitor the client's vital signs closely. Answer. B. Discontinue the 4 antibiotic immediately. Question 7. A nurse on a cardiac unit is caring for 4 clients. Which client should the nurse assess first? A. Client with a history of atrial fibrillation who reports feeling dizzy. B. Client scheduled for discharge after cardiac catheterization. C. Client ambulating in the hallway post-coronary artery bypass surgery. D. Client awaiting dietary counseling for hyperlipidemia. Answer. A. Client with a history of atrial fibrillation who reports feeling dizzy. Question 8. Which task can be safely delegated to a UAP? A. Changing a sterile dressing. B. Feeding a client with aspiration precautions. C. Assisting with hygiene for a stable client. D. Teaching a client about diabetic foot care. Answer. C. Assisting with hygiene for a stable client. Question 9. The nurse is assigned to 4 clients. Who should the nurse see first? A. Client with blood glucose of 240 milligrams per deciliter awaiting morning insulin. B. Client with enforcite that appears red and tender. C. Client with a nasogastric tube reporting nausea. D. Client on telemetry with frequent premature ventricular contractions. Answer. D. Client on telemetry with frequent premature ventricular contractions. Question 10. Which action is appropriate for the nurse to assign to an LPN? A. Developing discharge teaching. B. Starting in 4-line. C. Administering 4-push pain medication. D. Monitoring for infusion rate for a stable client. Answer. D. Monitoring for infusion rate for a stable client. Question 11. The nurse observes a UAP positioning a client with a chest tube. Which action by the UAP requires intervention? A. Placing the client in a semi-Fowler's position. B. Positioning the drainage system below chest level. C. Clamping the chest tube when repositioning the client. D. Ensuring there are no dependent loops in the tubing. Answer. C. Clamping the chest tube when repositioning the client. Question 12. Which client should the nurse assess first after receiving the shift report? A. Client receiving tube feedings with a residual of 50 milliliters. B. Client with heart failure who gained 2 kilograms overnight. C. Client requesting pain medication. D. Client with a blood pressure of 138/86 mmHg. Answer. B. Client with heart failure who gained 2 kilograms overnight. Question 13. Which client care activity is appropriate to delegate to a UAP? A. Assisting a client with ambulation using a walker. B. Instructing a client about wound care. C. Evaluating a client's risk for falls. D. Performing wound irrigation. Answer. A. Assisting a client with ambulation using a walker. Question 14. Which task should the nurse delegate to the LPN? A. Conducting initial teaching on a new diagnosis. B. Assessing a client for potential complications. C. Administering routine oral medications. D. Performing discharge teaching. Answer. C. Administering routine oral medications. Question 15. The nurse is preparing to discharge a client who had a stroke. Which action should the nurse take first? A. Provide written discharge instructions. B. Schedule the follow-up appointment. C. Verify the client's ability to swallow safely. D. Notify the family about transportation arrangements. Answer. C. Verify the client's ability to swallow safely. Question 16. The nurse enters a room and finds the client on the floor. What is the nurse's first action? A. Call for help. B. Assess the client's level of consciousness. C. Move the client back to bed. D. Notify the healthcare provider. Answer. B. Assess the client's level of consciousness. Question 17. Which client should the nurse see first after shift handoff? A. Client with a blood pressure of 180/90 mmHg scheduled for antihypertensive medication. B. Client who reports new onset of chest pain. C. Client scheduled for wound dressing change. D. Client who needs assistance ambulating. Answer. B. Client who reports new onset of chest pain. Question 18. Which action demonstrates safe delegation to the UAP? A. Asking the UAP to perform a sterile urinary catheter insertion. B. Instructing the UAP to assist with meals for a client on aspiration precautions. C. Assigning the UAP to obtain a client's initial vital signs post-surgery. D. Delegating administration of subcutaneous insulin. Answer. B. Instructing the UAP to assist with meals for a client on aspiration precautions. Question 19. The nurse is preparing to administer medications to a client with dysphagia. What is the priority action? A. Place the client in a supine position. B. Offer small sips of water with each pill. C. Crush all medications and mix with applesauce. D. Assess the client's ability to swallow. Answer. D. Assess the client's ability to swallow. Question 20. A nurse is prioritizing care for 4 clients. Which client should the nurse assess first? A. Client with suspected sepsis and a temperature of 102.4 degrees Fahrenheit 39.1 degrees Celsius. B. Client receiving blood transfusion who reports pruritus. C. Client with chronic obstructive pulmonary disease needing a nebulizer treatment. D. Client with an indwelling catheter who has dark amber urine. Answer: B. Client receiving blood transfusion who reports pruritus. Question 21. A nurse is caring for a client post-abdominal surgery. Which finding requires immediate intervention? A. Pain score of 7 out of 10 reported 2 hours after analgesic. B. Absent bowel sounds in all 4 quadrants. C. Urine output of 20 milliliters per hour for the past 2 hours. D. Blood pressure of 140/86 mmHg. Answer: C. Urine output of 20 milliliters per hour for the past 2 hours. Question 22. Which client should the nurse assess first? A. Client who received morphine and reports itching. B. Client receiving oxygen at 2 liters per minute and has oxygen saturation of 89%. C. Client with a new prescription for a low-sodium diet. D. Client with an foresight that is warm to touch. Answer: B. Client receiving oxygen at 2 liters per minute and has oxygen saturation of 89%. Question 23. The nurse is delegating tasks to the UAP. Which task is appropriate? A. Assisting a client post-hip surgery with ambulation for the first time. B. Collecting a urine specimen from an indwelling catheter. C. Assisting a stable client with toileting. D. Performing a dressing change on a surgical wound. Answer: C. Assisting a stable client with toileting. Question 24. A client with a feeding tube is at risk for aspiration. What is the nurse's priority action? A. Elevate the head of the bed to 30 to 45 degrees during feeding. B. Verify tube placement with air insufflation. C. Administer feedings rapidly to prevent clogging. D. Flush the tube with 30 milliliters of water before feeding. Answer: A. Elevate the head of the bed to 30 to 45 degrees during feeding. Question 25. The nurse is caring for a client post-thyroidectomy. Which assessment finding requires immediate action? A. Reports hoarseness. B. Neck dressing has a small amount of serosanguinous drainage. C. Calcium level of 8.5 milligrams per deciliter. D. Stridor and difficulty breathing. Answer: D. Stridor and difficulty breathing. Question 26. Which task should the nurse delegate to a UAP? A. Educating a client about postoperative activity restrictions. B. Performing range of motion exercises for an immobilized client. C. Administering subcutaneous insulin. D. Evaluating a client's response to a new medication. Answer: B. Performing range of motion exercises for an immobilized client. Question 27. The nurse is caring for a client receiving a blood transfusion. Which finding requires immediate intervention? A. Temperature increase of 1 degree Fahrenheit. B. Mild itching. C. Back pain and chills. D. Blood pressure increase from 120/80 mmHg to 130/84 mmHg. Answer: C. Back pain and chills. Question 28. A nurse is caring for a client with heart failure. Which order should the nurse question? A. Insert an indwelling urinary catheter. B. Administer 40 milligrams for furosemide. C. Place the client on a low-sodium diet. D. Administer 1 L normal saline bolus. Answer: D. Administer 1 L normal saline bolus. Question 29. The nurse is reviewing the care plan for a client with Alzheimer's disease. Which intervention is most important to include? A. Provide frequent reorientation. B. Encourage independent decision-making. C. Teach complex new tasks daily. D. Use abstract language when speaking. Answer: A. Provide frequent reorientation. Question 30. The nurse is planning care for a client at risk for falls. Which action is a priority? A. Keep bed in lowest position. B. Place a fall risk sticker on chart. C. Encourage client to call for help before getting up. D. Perform a fall risk assessment once per week. Answer. A. Keep bed in lowest position. Question 31. Which client should the nurse assess first? A. Client with diabetes reporting tingling in feet. B. Client receiving chemotherapy with oral temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius. C. Client scheduled for physical therapy. D. Client with a pressure ulcer needing dressing change. Answer. B. Client receiving chemotherapy with oral temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius. Question 32. The nurse is preparing to delegate care to the UAP. Which task is most appropriate? A. Assisting a client to the bathroom after receiving opioid analgesia. B. Measuring and recording oral intake and urinary output. C. Performing sterile wound dressing change. D. Monitoring a client's foresight for complications. Answer. B. Measuring and recording oral intake and urinary output. Question 33. A client receiving 4-heparin for deep vein thrombosis suddenly reports chest pain and shortness of breath. What is the nurse's first action? A. Increase 4 fluid rate. B. Notify the healthcare provider immediately. C. Assess oxygen saturation and apply oxygen. D. Stop the heparin infusion. Answer. C. Assess oxygen saturation and apply oxygen. Question 34. The nurse is caring for a client with a head injury. Which finding requires immediate action? A. Vomiting. B. Headache rated 6 out of 10. C. Urine output of 50 milliliters per hour. D. Restlessness and confusion. Answer. D. Restlessness and confusion. Question 35. A nurse is preparing to administer medications through a central line. What is the nurse's priority action? A. Flush the line with sterile water. B. Verify placement with a chest X-ray if newly inserted. C. Check for blood return and patency. D. Administer medications using rapid bolus technique. Answer. C. Check for blood return and patency. Question 36. The nurse is observing a new graduate nurse perform wound care. Which action requires intervention? A. Washing hands before the procedure. B. Using sterile gloves for the dressing change. C. Cleaning the wound from the outer edge inward. D. Labeling the dressing with date and time. Answer. C. Cleaning the wound from the outer edge inward. Question 37. The nurse enters a client's room and notes the infusion pump is alarming occlusion detected. What should the nurse do first? A. Stop the infusion and restart it. B. Reposition the client's arm. C. Check the foretubing and site for kinks or infiltration. D. Increase the infusion rate. Answer. C. Check the foretubing and site for kinks or infiltration. Question 38. A nurse is caring for a client with suspected stroke. Which order should the nurse complete first? A. Start 4 fluids. B. Obtain blood glucose level. C. Administer aspirin 325 milligrams PO. D. Send the client for CT scan of the head. Answer. B. Obtain blood glucose level. Question 39. The nurse is caring for 4 clients. Who should the nurse assess first? A. Client with suspected appendicitis reporting severe right lower quadrant pain. B. Client 4 hours post-op hip replacement needing assistance to reposition. C. Client with COPD needing scheduled nebulizer treatment. D. Client reporting 2 tense chronic back pain. Answer. A. Client with suspected appendicitis reporting severe right lower quadrant pain. Question 40. The nurse is preparing to administer an 4 antibiotic. What is the nurse's priority action before administration? A. Assess the foresight for patency and signs of infiltration. B. Check the client's identification band. C. Explain the purpose of the medication to the client. D. Obtain the client's vital signs. Answer. A. Assess the foresight for patency and signs of infiltration. Question 41. A nurse is caring for a client with C. difficile infection. Which infection control precaution is required? A. Standard precautions only. B. Droplet precautions. C. Airborne precautions. D. Contact precautions. Answer. D. Contact precautions. Question 42. A client is receiving total parenteral nutrition, TPN. Which finding requires immediate intervention? A. Blood glucose of 145 milligrams per deciliter. B. Serum potassium of 4.0 milliequivalent/L. C. Temperature of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. D. Weight gain of 1 pound over 24 hours. Answer. C. Temperature of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. Question 43. The nurse is caring for a client with a chest tube. What finding requires immediate intervention? A. Bubbling in the water seal chamber during exhalation. B. Continuous bubbling in the suction control chamber. C. Fluctuation of water level in the water seal chamber. D. Continuous bubbling in the water seal chamber. Answer. D. Continuous bubbling in the water seal chamber. Question 44. A client receiving 4 potassium chloride reports burning at the infusion site. What is the nurse's first action? A. Slow the infusion rate. B. Discontinue the foresight. C. Apply a warm compress. D. Notify the provider. Answer. A. Slow the infusion rate. Question 45. A client with atrial fibrillation is receiving warfarin. Which lab value should the nurse monitor? A. APTT. B. INR. C. Platelet count. D. Bleeding time. Answer. B. INR. Question 46. The nurse is caring for a client receiving opioids. Which finding requires immediate intervention? A. Client is difficult to arouse. B. Respiratory rate of 16 breaths/min. C. Mild itching. D. Urinary retention. Answer. A. Client is difficult to arouse. Question 47. The nurse is teaching a client about home oxygen use. Which statement indicates a need for further teaching? A. I will avoid using an electric razor while on oxygen. B. I will not use petroleum-based products near my oxygen. C. I will store oxygen tanks in a cool, dry place. D. I can smoke as long as I keep the oxygen at a low flow. Answer. D. I can smoke as long as I keep the oxygen at a low flow. Question 48. A nurse is caring for a client with an epidural catheter for pain control. Which finding requires immediate intervention? A. Blood pressure of 140/86 mmHg. B. Temperature of 99.2 degrees Fahrenheit, 37.3 degrees Celsius. C. Client reports new onset of numbness and weakness in the legs. D. Itching at the catheter insertion site. Answer. C. Client reports new onset of numbness and weakness in the legs. Question 49. A client with COPD is experiencing increased shortness of breath. What is the nurse's priority action? A. Increase oxygen to 6 liters per minute via nasal cannula. B. Place the client in high Fowler's position. C. Notify the healthcare provider. D. Administer an opioid for anxiety. Answer. B. Place the client in high Fowler's position. Question 50. Which intervention should the nurse implement first for a client experiencing anaphylaxis? A. Start in 4-line. B. Administer epinephrine. C. Administer for corticosteroids. D. Place the client in a supine position. Answer. B. Administer epinephrine. Question 51. A client who is 1 day postoperative after hip replacement suddenly becomes confused. What is the nurse's priority action? A. Reorient the client frequently. B. Assess oxygen saturation. C. Administer pain medication. D. Apply bilateral wrist restraints. Answer. B. Assess oxygen saturation. Question 52. The nurse is teaching a client about fall prevention. Which client statement indicates understanding? A. I will get up quickly to go to the bathroom. B. I will keep frequently used items within reach. C. I will wear loose slippers when walking. D. I will avoid using my call light. Answer. B. I will keep frequently used items within reach. Question 53. The nurse is preparing to administer a scheduled morning insulin dose. The client's blood glucose is 65 milligrams per deciliter. What is the nurse's priority action? A. Administer the scheduled insulin dose. B. Recheck blood glucose in 30 minutes. C. Give the client orange juice and recheck blood glucose. D. Notify the healthcare provider immediately. Answer. C. Give the client orange juice and recheck blood glucose. Question 54. A client with a tracheostomy is unable to clear secretions effectively. What should the nurse do first? A. Encourage the client to increase oral fluid intake. B. Perform tracheostomy suctioning. C. Increase the humidification on the oxygen. D. Administer a mucolytic medication. Answer. B. Perform tracheostomy suctioning. Question 55. The nurse is caring for a client with a new colostomy. Which task can be delegated to a UAP? A. Teaching the client how to empty the colostomy bag. B. Assisting the client with colostomy care after instruction by the nurse. C. Assessing the stoma for signs of infection. D. Documenting stoma assessment findings. Answer. B. Assisting the client with colostomy care after instruction by the nurse. Question 56. A nurse is preparing to administer 4 vancomycin. What is the nurse's priority action before administration? A. Check the client's potassium level. B. Verify the client's creatinine and BUN levels. C. Assess the client's blood glucose level. D. Check the client's magnesium level. Answer. B. Verify the client's creatinine and BUN levels. Question 57. A nurse is caring for a client in the emergency department with suspected meningitis. Which action should the nurse take first? A. Administer prescribed antibiotics. B. Place the client on droplet precautions. C. Prepare the client for lumbar puncture. D. Notify the healthcare provider. Answer. B. Place the client on droplet precautions. Question 58. A client with a central venous catheter reports chest pain and shortness of breath during flushing. What is the nurse's first action? A. Continue flushing slowly. B. Clamp the catheter and place the client on the left side. C. Notify the healthcare provider immediately. D. Administer oxygen at 4 liters per minute via nasal cannula. Answer. B. Clamp the catheter and place the client on the left side. Question 59. A client with a chest tube drainage system has no fluctuation in the water seal chamber. What is the nurse's priority action? A. Increase suction pressure. B. Check for a kink or clot in the tubing. C. Document as expected finding. D. Empty the drainage collection chamber. Answer. B. Check for a kink or clot in the tubing. Question 60. The nurse is preparing to administer digoxin to an adult client. The apical heart rate is 54 beats/min. What is the nurse's priority action? A. Administer the medication as prescribed. B. Hold the medication and notify the provider. C. Reassess the heart rate in 30 minutes. D. Give a reduced dose of the medication. Answer: B. Hold the medication and notify the provider. Question 61. A nurse is preparing to insert a Foley catheter in a female client. What is the nurse's priority action to prevent infection? A. Lubricate the catheter well. B. Use sterile technique during insertion. C. Secure the catheter after insertion. D. Encourage fluid intake post-insertion. Answer: B. Use sterile technique during insertion. Question 62. A client with peripheral foresight reports burning and redness. What is the nurse's first action? A. Discontinue the foresight. B. Slow the infusion rate. C. Apply a warm compress. D. Notify the healthcare provider. Answer: A. Discontinue the foresight. Question 63. The nurse is teaching a client about dietary restrictions while taking warfarin. Which food should the client limit? A. Bananas. B. Milk. C. Broccoli. D. Potatoes. Answer: C. Broccoli. Question 64. A nurse is assessing a client post-bronchoscopy. Which finding requires immediate action? A. Mild sore throat. B. Blood-tinged sputum. C. Decreased breath sounds. D. Drowsiness. Answer: C. Decreased breath sounds. Question 65. The nurse is caring for a client with SIADH. Which assessment finding is a priority? A. Increased urine output. B. Dry mucous membranes. C. Low serum sodium level. D. Increased thirst. Answer: C. Low serum sodium level. Question 66. The nurse is caring for a client receiving enoxaparin. Which lab value requires immediate follow-up? A. Hemoglobin of 12.8 g/dl. B. Hematocrit of 39%. C. Platelet count of 45,000/mm superscript 3. D. Potassium level of 4.2 milliequivalent/L. Answer: C. Platelet count of 45,000/mm superscript 3. Question 67. The nurse is preparing to discharge a client with newly diagnosed diabetes mellitus. Which task cannot be delegated to the UAP? A. Checking blood glucose level. B. Assisting with hygiene needs. C. Transporting the client to the discharge area. D. Teaching about insulin administration. Answer: D. Teaching about insulin administration. Question 68. A client with left-sided stroke is at risk for aspiration. Which nursing action is a priority? A. Encourage fluid intake with meals. B. Place the client in high Fowler's position during meals. C. Serve meals with large bites of food. D. Provide thin liquids only. Answer: B. Place the client in high Fowler's position during meals. Question 69. The nurse is caring for a client with suspected hypoglycemia. Which finding requires immediate action? A. Diaphoresis. B. Headache. C. Nervousness. D. Unresponsiveness. Answer: D. Unresponsiveness. Question 70. A client receiving chemotherapy reports mouth sores. What is the nurse's priority teaching? A. Use a firm bristled toothbrush. B. Rinse mouth with alcohol-based mouthwash. C. Perform frequent mouth rinses with saline. D. Increase intake of citrus juices. Answer: C. Perform frequent mouth rinses with saline. Question 71. The nurse is caring for a client receiving 4 antibiotics who develops a rash and shortness of breath. What is the nurse's first action? A. Stop the 4 infusion. B. Call the rapid response team. C. Elevate the head of the bed. D. Administer diphenhydramine. Answer. A. Stop the 4 infusion. Question 72. The nurse is preparing to administer a blood transfusion. What is the priority step before starting the transfusion? A. Monitor the client's urine output. B. Warm the blood product. C. Verify the client's identification with another nurse. D. Prime the 4 tubing with normal saline. Answer. C. Verify the client's identification with another nurse. Question 73. The nurse enters the room of a client with a seizure disorder who is actively seizing. What is the nurse's first action? A. Place a tongue blade in the client's mouth. B. Restrain the client's movements. C. Turn the client onto their side. D. Attempt to insert an oral airway. Answer. C. Turn the client onto their side. Question 74. The nurse is caring for a client with a new diagnosis of hypertension. Which statement by the client requires further teaching? A. I will reduce my sodium intake. B. I will monitor my blood pressure at home. C. I can stop taking my medication once my blood pressure is normal. D. I will exercise regularly. Answer. C. I can stop taking my medication once my blood pressure is normal. Question 75. The nurse is caring for 4 clients. Which client should the nurse assess first? A. Client reporting chest pain and nausea. B. Client with a blood glucose level of 220 milligrams per deciliter. C. Client scheduled for discharge in 1 hour. D. Client requesting pain medication for chronic back pain. Answer. A. Client reporting chest pain and nausea. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.